I now have this privilege and opportunity to officially launch the civil society platform on drug abuse.
Andrew Jaya Kaikai, Executive Director of the National Drug Law Enforcement Agency of Sierra Leone, formally launching the civil society platform on drugs and substance abuse.
One of the things I know and I understand very well, that civil society actors, you are the voice of the voiceless. You are the ones that play this critical role between government and the citizenry.
The platform was formed in April with the objective of providing a unified direction for civil society organizations working on drug-related problems in the country. The official launching marks the beginning of the implementation of its activities. This ceremony preceded a two-day training of members of the platform and other CSOs on advocacy and mobilization techniques in tackling drug-related harms. The idea of the platform was first conceived after the declaration of a national emergency on drug and substance abuse by President Julius Maada Bio. Two of the country's leading CSOs, Foundation for Rural and Urban Transformation, or FORUT, and Social Linkages for Youth Development and Child Link, spearheaded the formation of the platform. Alhassan Jallo, Head of Programs at FORUT, who is also the acting national coordinator of the platform, explains its objective.
Tackling drug abuse in Sierra Leone, and also to serve as a platform for information sharing and learning for advocates as well as activists.
And we are all seeing the way Kush is thriving in our community, more especially with a young population. But since that declaration has been called, we are not seeing much.
The presidential declaration in April followed reports of mass deaths of youth from the synthetic drug called Kush, a cannabinoid substance at the center of the epidemic. President Bio has since formed a national task force which is charged with the responsibility of coordinating the government response to the crisis. Mr. Kaikai is co-pillar lead for security in the National Task Force. He reiterated government's commitment to fulfilling its promises in tackling the crisis.
Our primary goal or our primary role is the disruption or the dismantling of the drug cartels, of the drug supply chains. Mr. Chairman talked about care and treatment. I don't care how much care and treatment centers we set up across the country. If we fail to disrupt and dismantle the supply chains, then we'll be back to square one.
The event was characterized by testimonies from former drug users like Joseph Santigi Bangura.
We are actually going in the wrong direction, if I can say, because we are going directly for the people that we are suffering. So I'm glad that they raised up a campaign that they said, support, do not punish. This campaign has a very strategic plan. First, we have a rehabilitation center, and this rehabilitation center, I can say, Chief, it's very necessary. But one thing again, let us don't rehabilitate fully. We reintegrate and trying to transform their lives, because a lot of them want to be transformed.
A major concern among campaigners is the country's capacity to accommodate the large number of demand for rehabilitation and to match that with reintegration of rehabilitated drug addicts into the communities. The inauguration of the Drug Rehabilitation Center at the Sierra Leone Psychiatric Teaching Hospital in June brought to 2 the number of such facilities in the country. But still, between them, there is just about 200 rooms for people needing the service. Yet, according to John Buckle, Social Services Officer in the Ministry of Social Welfare, there is a huge demand for services daily.
Every day, we've got massive recruitment or massive intake. Every day, there are parents coming to register their kids in SO2. And we begin the thief now, we begin the say we can register.
Campaigners say government must match words with action to overcome this and all other challenges currently facing the response efforts.
That's why we're calling on the government, the ministry, to call all those civil society organizations who are working with drugs people, to empower them and have these rehab centers. Once we have these community-based rehab centers, then I will not say we'll succeed in the fight, but we'll go far in the fight.